It is our honor, our privilege, and our pleasure to have you here, Maureen. We're so excited to have you here. You're going to add so much value to our discussion on nursing excellence. Please have the stage.
Well, I just want to say thank you so much for having me here today. It is truly my honor and privilege to be able to speak with all of you today. Very excited to be here and really talking about how Magnet provides a framework for nursing excellence. I'm going to start with talking about Magnet and where we fit within the American Nurses Association enterprise. So when we look at a healthy world through the power of nursing, that is the message of what we call ANA Enterprise, which is comprised of the ANA, which is a membership that does a lot of work on policies and really looking at how to raise the bar for nursing. Then we have the foundation. The foundation does a lot of work with, you might be familiar with, end nurse abuse. For nursing violence, you might be familiar with some of the grants that they provide. They do quite a bit of work in promoting nursing and really looking at research specific to nursing care. And then, of course, the American Nurses Credentialing Center, which is where Magnet sits. And you will also be hearing from Dr. Sherry Cosme later, and she is also part of the ANCC, her program. So some little signs you might be familiar with. You saw one just a few moments ago. The round one indicates that you are on the official journey to Magnet. And what that means is you have applied or you're part of our pre-intent program, but you've truly made a commitment to nursing excellence. And then the one below it is when you have achieved nursing. So when you see the one below it, you know that they are a Magnet hospital. Then we have our Pathway to Excellence program, our accreditation program, which includes continuing education, and the practice transition program that Sherry represents. And then, of course, we have our individual certification program. So what does that mean? When you look at all of these programs together, and this is why I like to start with this, is it means that they are all interconnected. Each one of these programs leverages the other program, and when you look at all of these, how they interact to truly create that culture of nursing excellence. So when you think about all of them, you're fostering interprofessional collaboration, you're advancing professional practice, you're having a sustained culture of excellence, because it's important to note that all of the credentialing programs, including Magnet, or I should say I'm a little biased, especially Magnet, has a sustained culture of excellence. This is not one and done. You don't receive the recognition and say, okay, we're all set. What it means is this is ongoing work. You always look for that higher bar to achieve. And of course, when we talk about all of our programs, we are absolutely talking about engagement, making sure that nurses have a voice. Ooh, sorry. Okay, now what about Magnet itself? I'm not going to talk about the history too much because I know Dr. Kwan is going to speak to that in a little bit. But I do think it's important to note that all of the things with Magnet are evidence-based. Everything starts way back in 1983 with a little study, as Maggie McClure says, that really just took off, and people really saw that these are foundational to nursing excellence. If you have these 14 forces, as they called them, in place, you are going to have a culture that supports nursing. Then in 2007, the Commission on Magnet looked again. Hey, let's see if these are still true. Let's see if there is still meaning behind those 14 forces. And not surprisingly, the answer was absolutely. Those are still foundational. But what they did do was take the 14 forces and encompass them within the component as we see it today, the Magnet model, that has the component of structural empowerment, exemplary professional practice, new knowledge and innovation, and transformational leadership. In 2020, the Commission on Magnet really took a look again at the mission and vision of Magnet and said, we have really moved beyond the previous one. We are truly a global program, and we need to be thinking about how to promote nursing and health beyond the U.S. walls, because we already were well enculturated in many organizations across the world. So as you can see here, and I won't read it for you, I know that you will be able to take a look at this, but it's truly about that collaboration. It's about nursing excellence. It's about the world vision. It's also about not only the patient, but the community in which they live. I'm going to pause for just a moment. And then when we look at Magnet, and we think about what it truly means, and again, what it does, Magnet does not tell you how to do things. Oh, okay. What Magnet does is it does not tell you how to do things. What it does is tell you what you should have in place to have a culture of nursing excellence. So we like to say it provides a roadmap. It gives you the directions. We don't say to you how to do your shared governance. We say we know successful nursing organizations have a shared governance, and this is what you should have in place. And again, what that means, I don't know what I just did. There we go. So what that means is you are truly looking at the culture that Magnet brings by having the items that Magnet requires in place, but how you put them in place is up to your organization. It is up to how you choose to develop that culture within your facility. Okay, yesterday we had the privilege of doing a tour of the Al-Musa Hospital. And I have to say, it was an incredibly impressive tour. The nurses, their enthusiasm, the energy was so important. And when we look, or so evident, and when we look at some of the key fundamental, foundational elements of Magnet, then we can see how they are being lived. When we think about the access to leaders, one thing that really impresses me when I visit a hospital, and I saw it yesterday, is that everyone knows their chief nurse. Everyone can feel comfortable coming up and talking to them and joking with them. Alik was joking with everybody about the Magnet and what they ask for and how they get things, and putting it in context of Magnet. And it's so true. You have access to your leaders and you are comfortable approaching them. You're comfortable speaking with them. They are available to you. And it's not just about saying, oh, we get feedback. We ask the nurses what they thought. It's listening to the nurses and what their input was, and then incorporating it into the culture. Mentoring. So many nurses yesterday told us their stories of being mentored. Autonomy, being able to work at the top of your license, being able to make decisions about the care that you're providing, being able to have a voice and being comfortable that you have that voice and can speak for your practice. Interprofessional collaboration. Foundational. Nursing does not exist in a void. It has to be part of an entire team. You have to be able to work and interact with those team members and truly find what is happening for that patient to really have successful outcomes. Nursing research. a huge part of Magnet. And why is that a big part of Magnet? Why does Magnet say that you should have research happening in your organization? Because you should be part of raising the bar for nursing. You should be finding that evidence yourselves. You should be incorporating and really living that piece of very critical knowledge that you're developing within your organization. Innovation, that's all part of the working with nursing research, and then peer feedback. I know that sometimes peer feedback, mentoring, transitioning, feels a little bit like, well, what does that really look like? Peer feedback, why is it important? Well, peer feedback gives you that look at your blind spots. We all have blind spots, every single one of us. And we can't be aware of them because they are blind spots. But when somebody says to us, hey, you know, when this happens and you could do this better, when you have those crucial conversations, it goes so far. Now, yesterday we had the privilege of meeting so many nurses, and I just want to do a call out. If you are part of the shared governance, can you please stand up? Is anybody here part of shared governance? Okay. So if you keep standing, now tell us who is involved in nursing research here. I heard that there's multiple studies happening. Just the same people? Anyone else involved? Okay. Yep, a few more people standing. And who has either had a mentor or worked as a mentor for someone? Excellent. Everybody, exactly. So if you are a clinical nurse, please stand up. Because you are what Magnet is all about. It is about the clinical nurse. So I'm going to just give you a little round of applause and thank you for the work that you do. I know there were more of you than that stood up. I just want to say that. So, one of the things that sets Magnet apart from other credentials, from other organizations, is the fact that we really look at that evidence-based practice that has empirical outcomes. It's not just enough to have a structure and process in place, although in order to get the right outcomes, you must have that structure and process in place. But how do you know it? You know it by having measurement. And when you measure and you see whether there is an impact from the work that you have been doing, that is an empirical outcome. That is how you know that you are improving your culture and your organization. So a critical piece is the empirical outcomes for Magnet. And to do that, again, we always refer to the Donabedian model because it's such an important part of what we do throughout ANCC. Every single program in ANCC refers to and talks about the Donabedian structure, model of quality, because it is so important to the work that nurses do. You have to have the right structure in place. The right structure leads to the right process. And then if you have the right process in place, you will get the so what. Why are you doing this work? It is for that outcome. Whether it is for your nurses, whether it is for your patients, and how tied they are cannot be understated. And this is some, again, evidence-based results that we know Magnet provides. We know that it causes increased nurse retention and lower nurse burnout. How does it do that? Because you are engaged, because you have a voice, because you can talk to your leaders, because you are heard by your leaders. That you have a decrease in that turnover rate, in your vacancy rate, because it's easier to bring nurses in when they know that there is a culture of excellence. The cost, the amount of money organizations start, and it's always important to talk about cost saving, because where does that money go when you save costs on not losing nurses? It goes back to the patients, it goes back to the nurses, so that you can have more things available. And then, of course, increased patient satisfaction. It's all tied. When you look at when your nurses are engaged, we know that their patients get better care and the patients are more willing to say, oh, you know what, I need to get up and use the restroom. I have this need, I'm having pain, whatever their issue is. If they have a good nurse who is listening to them, patients are more comfortable to say what they need, so that improves their experience. But the reason patient experience matters so much is because it translates to improved patient outcomes, and that is what we're all here for. Then, of course, all that translates to an improvement in those outcomes, in decreased morbidity, increased satisfaction, decrease in the average length of stay, decrease in falls. I was hearing about some falls initiatives yesterday, some amazing data on CAUTI and CLABSI that was truly remarkable, on people having 0 for a year. That's fabulous work. So, again, and this is, I cannot emphasize this enough, the importance of Magnet is this is not a snapshot in time. Number one, you do not do things for Magnet. You do things because it is the right thing to do for your patients, for your coworkers, for the culture of your organization. It is not for Magnet. It is for you. Number two, it is an ongoing process. This is never going to be something that you are done with. This is always about looking at that next horizon, looking at what's next to do, and how are you going to achieve it and move there. It's so important to always be looking ahead. And last but not least, I came across this statement from Vince Lombardi, who, for people who are familiar with American football, might be familiar with the name Vince Lombardi. He was quite a character, I will just say that, and quite well known in the U.S. But again, this misperception of Magnet is it's about perfection. That is not true. Perfection is not attainable. What is attainable is excellence. And you always are chasing perfection. You're always chasing that next level of excellence and how important that is. But that is what Magnet is. That is why the framework of Magnet matters, because it's always about shooting for that higher level of excellence and achieving it. So, that is all that I have for today. I hope you enjoyed my presentation, and I hope I stayed within my 15 minutes. Okay. But please do not hesitate to reach out and shoot me an email. I love hearing from you. Also, I know several people have reached out and on my LinkedIn, and please feel free to do that. You will see me on LinkedIn, whichever place. I'd love to hear from you.